Hey everybody, I thought I'd do a video because the story is so crazy and long that it's not that I don't like it talking about it, it's just that it's a very long story. So I figure if I do a video and post on Facebook, kind of like how I did, announcing that I was in the hospital, that the word can pass through and the stories can go through. First of all, I'd like to thank each and every one of you who was watching this video and or sent comments and stuff like that. All your thoughts, your comments, your prayers. Thank you. It really meant a lot to me. It did, if anything, give me hope and love and that sort of thing. Okay, so here we go. Some warning: this video may contain graphic urination. Okay. And not only do I have one tag, I have two tags because I'm extra special patient. Anyway. Okay, so this would have been, today is now Friday. This was Thursday. I was getting out of work about 2 o'clock, and I started heading home like I normally do. Taking the back roads. Ooh, my hair's a little bad. Taking the back roads and whatnot. And I was on US 52, which takes you straight into Ohio from Michigan, and I usually take Route 12, US Route 12 over. So as I'm getting to about US Route 12, I started realizing, hey, I gotta go to the bathroom. So I decided that next McDonald's, fast food restaurant, whatever, that I'm gonna go stop and pee there. So I get there, and it's like 4:30, and I go and I walk in and I start the urination process, and I start smelling the urine of other people, which was disgusting. And then all of a sudden I started feeling woozy, and then I have no idea, no recollection of passing out. But I remember having a good dream. At least it was a happy dream. I don't remember what kind of dream or who was in it, but I remember the feelings were happy. And I realized to myself, I became self-aware in the dream. Thanks to lucid dreaming, which I'm very good at. That I realized that I shouldn't be dreaming here because I'm not in bed. I'm somewhere else, but I don't know where. So I ended up coming to and realizing that I'm on the floor at McDonald's, and I peed everywhere. Everywhere. And my head hurt, which I don't know if you can see. Let me figure out where they are first. Don't know if you can see. Somewhere back here are 5 staples in my head. Because I hit my head on the molding or on the wall. I don't really know where. McDonald's bathroom. A comment has been made to me several times because I was out for 8 minutes. Did anyone come in? And I said, no. Apparently this McDonald's gets no bathroom traffic. So I started out with the basics, which is like, okay, head hurt, hand on back of hand. You can't see it anymore because I washed my hands. Had a little bit of red blood. And I'm like, well, and it was a small little corner spot, so it wasn't like bleh all over my hand, so I knew I wasn't like gushing. Because I've had that once long time ago, like almost 20 years ago. Picked myself back up, and I started going through the routine that we all do when we all worked public safety together, which is, do I know who I am? Do I know where I live? Do I know my address? Do I know what year it is? The president one, I wasn't thinking, because they did ask me about that, and I was like, oh, I wasn't prepared for the president question, but I passed. And that sort of thing. But my chest was just racing. And I wasn't sure if it was a combination of some sort of heart complications and or anxiety. Oh, sorry, not heart complications. Anxiety and embarrassment. Anxiety that, oh crap, I passed out in a McDonald's restroom. And I peed everywhere. And the embarrassment that I peed everywhere. And now what am I going to do? So I sat on the toilet for about 10-15 minutes or so. And I started doing some deep breaths. And basically I knew I had to get my heart rate down. So I started doing that. And I did that until I started feeling good. I was really slow, like moving, mainly because I thought, well, it's probably because the adrenaline is long since gone because I passed out. I knew it was not a heart attack because, and Dave can correct me if I'm wrong with this fact, but when we went through CPR training, that people who have a heart attack have their chance of survival go down 10% for every minute that their body does not receive life-saving CPR. So, since being 8 minutes, and I felt alrightish, that it wasn't that. So I went to my vehicle and sat in there again for 10 or 15 minutes or so, and I was debating myself. I'm like, okay, am I going to call this in? I'm not quite, I know where I'm at, but I'm not exactly sure in relationship to a hospital, and I'd rather go to Toledo, University of Toledo, which is next to Hilton, where Mimi works at, and that sort of thing. And I said to myself, you know what, I feel okay to drive. So, but I told myself, the moment I feel weird or I feel tired, I get off the side of the road and I call 911. But I was fine. I was just very dehydrated. I had some ice left in a cup that I was drinking, and I also drank like 1 day old whatever something was in the bottom of a cup from McDonald's. So let me get to meat and potatoes here. So I finally get to Toledo clinic. Got to the emergency room, and I walked in, and I said to the person, the front desk, I saw it was security at the front desk. I go, I need a doctor. And then he starts, walking me towards the desk, and I'm like, started explaining. I had my ID all ready to go, and I basically said Pilarczyk, Pilarcyk. Gave him my address. I kept repeating that just in case for some reason I'd forget it. And I saw a little sign, and I explained basically everything I just said. And I said my chest it's not painful. It just feels like I have anxiety. And I noticed the sign that said, please let us know if you have chest pains or something else. And I was like, I have chest pains. Realizing how it came out of my stupid face, that it may not have been necessarily treated as though I was, serious or whatnot. But in about 5 or so minutes after that, the triage nurse took me back to get the, what brings you in today? And I was very detailed with everything. Like I said, I woke up, my mouth was really dry. I said that was the indicator that I was out for more than a minute. And I was breathing heavy. All that fun stuff. Had to go to the bathroom, urinated everywhere. That sort of thing, the smell of pee, all this fun jazz. And so she had me hooked up to a couple different machines, and each machine was giving a different reading of what my heart rate was supposed to be. So she did a pulse, and she's like, your heart rate's irregular. And I do have an extra heartbeat, which has never caused me problems my whole life. And so she started walking me to the room. She's like, get this room ready now, type thing. And she basically told she politically chewed out the desk clerk, which I don't really care as long as I'm being taken care of. So they get me in the thing, and or in the treatment room, and they're trying to pump in medicine to get my heart rate down. Because guess what? My blood pressure was 220. Can you fathom that? It was insane. That's huge. So anyway, speeding up the story here, because I know I only have 15 minutes on YouTube here. Because it was working but not working fast enough, they had to give me this medicine that I can't remember. It begins with a D. That's what I remember. But the most strangest thing that I could think of was that that they said that patients have said that this feels like doom for 10 seconds. And I'm like, excuse me? I go, doom? And he basically said, feels like that this is it. You're not going to survive it. I felt like I was already mentally prepared. I'm like, I went to the other guy who me and him were joking with, or not, we were joking with a little bit before we got to this point. I said, don't worry, dude, I'm still here. And injected stuff, and it was a weird feeling. I can't describe it, but it was a wave that just went from my head all the way down to my toes. And after that, I dropped down to like 140 or 160. Still not really good, or maybe 130. I can't really tell you, but I was kind of all over the place because my heart was out of rhythm. So, did some, got 5 staples in my head at one point, x-rays galore, ultrasound, CT scan, tons of blood work, couldn't sleep, because they kept me overnight. I couldn't sleep because I felt like I was chained down with both arms with IVs and blood pressure pumps. I got gouges all over the place from where they taken so many blood samples. Because apparently, and just so you know, they can detect if someone has a heart attack, because when someone has a heart attack, their heart produces specific enzymes. I don't know what they do, but that's how they were able to tell. Because they had to give me a blood thinner, and the stuff that's basically keeping me alive. Oh, speaking of which, if I didn't go to the hospital, I wouldn't be here right now. Because they said that my heart wouldn't have been able to last being at 220 for a long period of time. So anyway, gonna skip forward to the next part. So this specialist that's world renowned, his name is Dr. Grubb, and actually I'm going to be seeing him in January, basically said this: I fall within a small 10% of the population that experience this. How our brains determine blood pressure is by the tension of blood vessels, and that can be from any part of your body. But unfortunately, and there's no way to figure out how this works, is that where your brain receives it is kind of in the same area where it receives for everything. So, because I had to go to the bathroom so bad that my bladder sent the message up to the brain saying, hey, we got a lot of high blood pressure in this area, my brain was going to probably ignore the call, but got distracted because not only was that, but I was also dehydrated and fatigued, and I smelled something funny, and then it's like, oh, okay, well, we'll just shut off the heart. So my brain shut off my heart, and he said it's a very, very rare case. He says it may not even happen again. He said just be mindful of what's going on. He said that, I'm actually okay. That's the crazy thing. No meds. Just got to go see him in 2 months so he can take a look at me and check some readings. But other than that, I'm feeling pretty good. I'm just really tired because I didn't really get a lot of sleep last night. Again, I appreciate everyone's phone calls, your text messages, your Facebook posts, and stuff like that. And also, thanks to everybody at the Toledo University of Toledo Health Group, because I had my choice of checking into any hospital, but I just happened to check into the best hospital because that's what everybody has told me so far. So I thank everyone for your support of myself. I will repeat the story a few handful of times, but it's pretty long and I don't want to bore you guys. So I'll see you around. I feel pretty good about myself, and I love you all. And hey, you know what? You gave me 1 day off of work. But I'll talk to you all later.